Hello and welcome. I'm Sadhika Tiwari. Today we are in conversation with Dr. Ravi Kannan. He's an Indian surgical oncologist based in Assam. He's the director of Kachar Cancer Hospital and Research Center. He was also awarded the Padma Shri in the category of medicine last year in 2020. Thank you, Dr. Kannan, for joining us. So over the last couple of years, we've seen the data has been showing us the trends that the number of cancer patients in the Northeast region have been higher than the rest of the country. The report launched by ICMR on the 4th of February this year showed the similar trends. So, I mean, what is the reason to these patients sort of, even the projected rise says that they're going to be higher than the rest of the country. So what's happening in the region that's contributing to this increase in patients?
I think it's predominantly lifestyle. Tobacco, areca nut, mainly, the number of people chewing and smoking is much higher than in the rest of the country. And the number of people using areca nut is also much rampant use of both tobacco and alcohol and areca nut. And I think that is the single most important reason why the number of cancers is much higher than in the rest of the most of the cancers that are higher are all tobacco related cancers. And that's why I think, and then there are other other smaller issues. There will be indoor pollution, because in some certain areas, they they the lifestyle is that they have a burning uh, and then they use of smoked meat. But these are all, I think, these all play a much smaller role. I think the single most important
Right.
reason is tobacco.
Also, how important is diagnosis, timely diagnosis at an advanced stage when it comes to cancer? And what are the requirements? I mean, for example, if I'm an individual who, I mean, what are the conducive sort of conditions that are required for me to enable an early diagnosis?
So, early diagnosis means that the community must be aware of cancer as a possibility. Early diagnosis means that there should be a facility available near one's home that is easily accessible. Early diagnosis means it has to be affordable. Early diagnosis, this applies to actually all healthcare, not only early diagnosis. It has to be equitably distributed. So whole lot early diagnosis means, there must not be long waiting lists. Many patients are daily wage earners. They cannot keep going back to the hospital again and again and again, one day for investigation, one day for appointment, one day for results, one day for repeat test. They lose wages. They, unless they earn every day, they can't eat. And so many things contribute to, you know, even though you have an accessible, affordable healthcare facility, people may still not be able to utilize the facility for a variety of reasons. And all of these have to be met if, we have to ensure that people get diagnosed and treated
Right.
early.
So, is access to affordable healthcare facility our only challenge, or also the availability of these facilities are also a problem that we're facing in the
Yeah. Obviously, So, in the northeast, access is a problem. The terrain is often, hilly. There are streams to be crossed. There are forests, and terrain is an issue. And then, till very recently, the number of facilities available have also been very limited. Now, the government is trying to put in facilities in every medical college in the region. There are medical colleges coming up in Kohima and in places where there were no medical colleges. But even then, it is going to take time. This is not something that can be addressed overnight. And then the availability of human resources, even though you may put facilities all over the place, human resources are not available. The natural trend has been from smaller cities to go to the next bigger city, from there to go to Delhi, Bombay, Madras, one of the metros, and then out. That is a normal trend. People want to move up in many terms, and so this is not going to be addressed overnight, but we are on the path.
Right. Also, so the recent data that in the report that was launched earlier the month in this month, we also see that not only are an increasing number of people going out of the state to seek treatment, which is specifically, I mean, higher in states like Sikkim and Nagaland. but also even in cities, in states where specialty centers are available, affordable healthcare is available, people are still, I mean, patients still choose to go outside their state to seek treatment. Why
So
do you
this has been a practice over many decades, because none was available. See, for a hospital to come up, and for the hospital to establish credentials, for the people to learn to trust and have faith in the system, is a process. You just cannot put up a hospital and expect everybody to have faith and come. So this turnaround will take time. People have been traditionally going away to Mumbai and Vellore and Chennai and Bangalore, and they continue to do that. And then there's word of mouth. People tend to go. Always, the tendency is to think the doctor in the next big town is much better than the doctor in your own village. And so, but then as more facilities come up, these things will change. We have to educate the people. We have to make sure there are resources available. We have to make sure the human resources in the hospitals are competent and compassionate. So this will take time.
Right. Also, when we're talking about cancer, what is the difference between the number of male patients and female patients, and respectively in both of the genders, what is the most rampant kind of cancer that we're seeing right now?
So the numbers of cancers are more or less evenly distributed. In men, lung cancers, oral cancers, esophageal cancers are probably the commonest cancers. In women, breast, cervical cancer, gallbladder cancer are the commonest cancers.
Right. And so when we talk of early diagnosis, uh, I mean, what amount of role does awareness play? I mean, even if you have a center, even if who tells you that, I mean, how important is it for us to make it a larger part of our life to understand? I mean, when should, does it need to be a regular checkup? Is it something that because clearly we're looking, I mean, data suggests that eventually like 1 in every 10 Indians is going to build up cancer through their lifetime. I mean, so if it is becoming a lifestyle disease of sorts, how do we need to, when do we know when to go for a checkup?
So traditionally, we are not a community that has a very strong health seeking behavior. For a variety of reasons, a lot of it is economic, some of it is awareness, and then there are other, cultural and social issues that prevent us from going to hospitals when we perceive ourselves to be well, when we are not sick. And the daily wages problem, adds to this. When I'm well, when I'm earning, why would I go and get checked and then find that I have a problem and then go for treatment? That is a common mentality. And then we also don't have a wellness concept. See, we are now shifting from communicable to non-communicable diseases as the nation progresses and becomes a developed country. And so, tobacco, alcohol, poor diet, lack of exercise, and untreated infections are the main causes of cancer in the country. If we can take care of these five issues, we would have taken care of more than 70% of cancers. The same causes also cause heart disease, causes stroke, causes diabetes, hypertension, COPD, peripheral vascular disease. So many other non-communicable diseases are caused by tobacco, alcohol, poor diet, and lack of exercise. So when we prevent cancer, we actually promote health in the community. And this is actually a profitable business. But this concept, profitable because when you don't smoke, when you don't drink, you save some money. When you don't fall ill, you don't go to hospitals over and over again, you don't pay consultation fees, you don't get yourself tested, you will save money. And then when the health of the community is good, we don't have to invest in expensive, exorbitant infrastructure to make sure that we treat people. See, when we fall sick because of tobacco or alcohol, when we buy tobacco, we're actually paying money to get a disease. Buy one, get one free concept. You buy the tobacco, but you get the disease for free. And so this concept is not as yet entrenched in our minds. The concept of wellness has to be promoted. and this requires behavior change. And in some areas, like underserved areas, removed from civilization, the concept is even poorer.
Right. So, Dr. Kanan, you worked extensively on the field at the grassroots level with these patients. What sort of issues do you see when it comes to uh, getting a diagnosis done, financially seeing a treatment through, and then post the treatment, you need some sort of rehabilitation of sorts? How does that pan out in lower income groups in rural areas?
See, that is the main problem, economics. The even the fact that they have to travel to a nearby hospital costs money. Travel from district to the next district is expensive. Then the question of wages, and then cancer care is not short duration. It's not like cataract surgery. You go and come back in the evening. It takes forever. Chemotherapy is so many months, radiation is 2 months, surgery by the time treatment is completed for a breast cancer or a cervical cancer, it's almost a year gone by. And then they have to get out of the ill effects of the treatment, fatigue, and they have to recoup. And then by the time they are back to productive work, it's more than a year gone by. And that impacts on the health of the family, on the economic viability of the family. And so this is a major reason, and then when they have to keep going back again and again and again and again, they keep losing revenue. Abandonment rates are very high. They tend to drop out. And then to top all of it, when they go there, they don't find they're being spoken to well, they're not cared for. It is easy to just give up and accept your fate and go back. It's a complex social issue, economic issue, and a management issue.
Right.
Many things have to go into it to make sure we may have good quality care, we may have accessible care, but the community has to accept it. And in order to make it acceptable, they must perceive the center to be compassionate and kind and supportive and respectful. And so many things have to go into it, and to make sure that everybody in the hierarchy follows the same philosophy and principles is not an easy task. To get a team of 200 people is fine, but in a government machinery where there are 8 hospitals or 15 hospitals, and there are thousands of people, how do you make sure everybody, somebody doesn't ask for a bribe, somebody is not rude to you, somebody, these are all complex issues. You cannot just change it overnight. It's easy for us to sit in a chair and say this must be done, this must be done, but to actually make it happen is not at all easy. And that's where we are headed.
So even when we look at policy interventions or government programs for infrastructure building or to spread greater awareness, what do you think? What do you sort of think are the basics that we are, which you have seen at the ground, which we are sort of missing, which are not letting these policies percolate?
So, see, the thing is, for example, now there is this state insurance in the PMJY, and in Assam state we have the Atal Amrit Abhiyan. Very good concepts, and there are teething troubles right now. It's just a couple of years, and things are not always right. But if implemented properly, if the end user is made aware of it, many people don't even know about it. And so, over a period of time, it will bring about change. They are putting up, both in the private sector I very strongly believe healthcare should be a government priority. It should not be left to private. I'm very, very sure, emphatic about that. Private players will not deliver what the government intends to deliver. But the government, for the government, there's nobody who has the kind of resources and the muscle that the government has. But then to make it happen in a government setup is not easy. What can happen in a private setup quickly will take years in a government setup. But then, like the NHS in the UK, that is the best way to go. Privatization of healthcare is, in my opinion, a strict no-no. It
Yes.
will not deliver. In my opinion, the whole healthcare industry, is a racket.
Yeah.
The doctor has a has an interest other than the patient, except for one person. Everybody in the healthcare industry has a vested interest. The administrator, the doctor, the nurses, the physicians, everybody except the patient himself or herself. For the patient, only his or her health is important. For everybody else, in addition to the patient, money is important, fame is important, going to a meeting is important, hospital revenue is important. So everybody has another interest to serve in addition to the patient's well-being, And so in the private sector, these conflicting interests are much stronger. So
yeah. So, Dr. Kannan, my last question would be, as you said, healthcare should be the government's top priority. Very quickly, if you could answer, is it currently?
unfortunately, I think no. I think the government is encouraging private players in a big way, both health and education. The government is abdicating its. That's what I feel. I may be wrong. I can be questioned on that, but my impression is government is not putting enough into healthcare.
Thank you so much, Dr. Kannan, for joining us. This was a rather great conversation. To all the viewers, thank you for joining us.